Hey, hello everyone. Hope all of you are able to see my screen and can hear me. Can I have a quick confirmation, please? Can you guys hear me? Yes or no? Wonderful. Thanks, Raja. Thanks for the confirmation. All right. So, what we were discussing. So, yesterday we started with our discussion with exposure, correct? In the interventions domain. So, we started discussing about interventions domains, correct? So what is this intervention domains primarily consists of? There are 4 domains in this. So we will start with exposure. Then we have exposure as collected. Then we have concomitant medication, right? And finally we have substance use. So these are the 4 domains we have under this. So primarily interventions is all about the drug or the treatment or what kind of medicine or what is going inside. Simply interventions will deal all it about what is going inside, what exactly happening with the treatment. If you're not talking about the study treatment, anything other than study treatment, anything other than study treatment, where it will go, where it will record? Can someone please tell me now? Anything other than the study treatment will be recorded under which domain? Can I say it is under the concomitant medication? CM is the domain which is responsible for any treatment, any drug or any medicine other than the study treatment or the study drug. That will flow here. The CM, the concomitant medication, can be because of the adverse event, or it can be because of the clinical event, or it can be because of the medical study. Suppose I want to deal with the study treatment. How the subject is responding for the study treatment I want to start, or how the treatment is giving to the subject, the study treatment. For this, SDTM has defined 2 different domains. One, if we have unblinded treatment, then go with your exposure data. If you have blinded, that can be single blinded, double blinded, or triple blinded, you can go with exposure as collected. Correct? So this is what we have discussed. Exposure primarily is of dealing with what is mentioned in the protocol. It is all about what is mentioned in the protocol. Are we going with that or not? When it comes to your exposure as collected, what is defined in protocol, how we administer that, and what we have collected. All the 3. It is all about, yes, we are going with the protocol, right? After that particular one, have you exactly given to the as per the protocol or not? Have you done any deviations, or have you forgot to give any of the medicine, or subject has not taken any of the medicine, or you have you adjusted any dosage or not? If yes, why? All these things you are going to administer and you are going to record. For that we have your exposure as collected domain. Then what are going to be the behavioral aspects of the subject? That will be go under your substance use. That we are going to discuss tomorrow. So today we will start with our discussion with what is your blinded data, how you are going to collect your blinded data, blinded treatment data, and what is called your exposure as collected. Correct? So these details yesterday itself I have given to you. Can you see that? So per SDTM implementation guide 3.2 version, the exposure domain should contain only the unblinded data for the study treatment, whereas your exposure as collected data, that domain will be having what is the blinded data that is used to collect your blinded data during the study for all administration given, not taken, or even missed. All these 3 we have to consider here. Most of your variables will be the same. It is going to consist the same variables will be in the repeated fashion. All right. So before we start with understanding the variables, right? Before we start with understanding what are the variables which are part of your exposure as collected and all, I want to talk about why it is required, right? Why can't you say that only EC is sufficient, or why can't you say that only EX is sufficient? Why we are going with, why the implementation guide is talking about we would need both the data sets. Maybe you can, even if you don't submit EC, that is fine, but EX is definitely required, right? Because EX is a derived data from, or derived domain data set from your EC, correct? Exposure, it can be derived from exposure as collected. Let's see one or two examples first, and then we can go with the data definitions and everything. So for that, I'm just going with a very simple example. Can you see this? I have some placebo controlled trial. This is my placebo controlled trial. On the left hand side, whatever you have is a exposure as collected. Whatever you can see it on the right hand side is nothing but your exposure. That is a regular one. So how do you understand this? See, maybe I can go with a simple Excel. So here I just want to define how my EC is first. Let's say this is my EC. So EC, we are going to have EC PRT, right? Because in the exposure domain we have EXPRT. EXPRT is nothing but yeah, what is your treatment? Am I correct on it? Simple category of your, sorry, not the category, it is going to be a name of the treatment. Then what you are going to have, once you have the name of the treatment, you are going to have dosage. Am I correct on that? I'm going to have the treatment. Once I have the treatment details, I'm going to have the dosage details. Then you may also go with the dosage units information, which is nothing but EX, DOS. The dosage units are going to be. So this is what yesterday we discussed, correct? We are going to define about three things. Primarily, when we talk about the drug, those are going to be, what is going to be the name of the drug or name of the treatment. Then what is going to be the dosage information. Then what are going to be our dosage units. These three are the ones which you primarily discuss about your treatment. This is about your exposure domain. This is what we discussed yesterday. Am I correct? Now, I'll tell you why or how it is going to be different from your exposure as treatment domain. Sorry, exposure as collected domain. Let me copy all these as is. This I can call it as exposure as collected domain. The name of the treatment remains going to be the same. Instead of EX, I'm going to have EC. The dosage remains going to be the same. I'm going to have EC. The dosage units also going to be the same. Here I'm going to have EC dosage units. Correct? Right. For an example, here they have given that it can be a treatment or it can be placebo. They mention your treatment as the treatment that you are giving as either it can be TRT or it can be placebo. Anything, it can be anything. And also they mentioned that it is going to be 150 mg of the 150 100 mg is going to be your tablet dosage. So now we need to understand there are two groups, right? One is going to be a, what are them? Controlled group. Another one is going to be a, what is the other group name? You remember? Initially we discussed during the definitions part, we talked about two groups. One group is going to have only the actual study pill or study treatment. The other group will be having only the placebo, or which is the wonderful interventions group. Controlled group, interventions group. This is what that intervention is the one we are talking about, right? So where it will be decided, can I say it will be decided after the screening? You're going to have the randomization. During the randomization stage, you're going to have these details. Am I correct? Yes or no? So by default, we said that the treatment is the exposure as selected. It simply says that, hey, it is going to be treatment or placebo, everything is going to be 150 mg. When it comes to your exposure domain, it have clear details. What do you mean by clear details? The clear details here is nothing but let me also note it down. So when it comes to this particular one, here it will be clearly mentioned because it's a unblinded, but it is going to be a proper, sorry, it is a blinded data, it is going to be unblinded. Or I can say that there is no masking. After unmasking, let's say the first guy got the original treatment as it is, 150 mg. Whereas the second guy, he got only placebo. Because we know, right, who got placebo, who got the actual treatment. Now the original doses become 0. There is no units. Even if you say mg, it's 0 mg. Again, the third guy got treatment. It's going to be 150, and here it is 50 mg. Now you can see, out of the 3 subjects that we have here, only 2 subjects got the treatment. The other guy falls under the different group, and he got only the placebo. So this unmasking, after unmasking, your exposure data set is actually giving the true picture of that. Am I correct? Is it making sense? How can you see this? Placebo control trial, your easy treatment is a general term. It is just going to give you the details about it. But when it comes to your exposure domain, your EXDRT is the one, here is the one where you have the exact treatment that you have given. Have you given treatment or have you given placebo? That details will be part of your placebo, not in your exposure as collected. And also you can see that the second guy got placebo, so the actual dosage is going to be 0. But here everywhere it mentioned as 150. Do you understand why do you need both the domain? If your sponsor has given your exposure as collected domain, then you can create your exposure domain by going with the proper details, because it is going to give you the true picture of what exactly happened there. Makes sense? First of all of you are able to follow this? If yes, I'm going to give you another example here. Right? This I can call it as a placebo defined trial. Here I'm going with maybe I can go with the double dummy trial. So this is the another one. I'll tell you what exactly going to happen here. In the double dummy trial, let's say there will be totally 2 trials. Sorry, there will be 2 treatments. Treatment A, treatment B, placebo. Totally 2 treatments. One is going to be placebo, right? So let's copy this. So here I'm going to have either it can be treatment A or treatment B or placebo. Your exposure as collected will give you a generic detail. It can be any one of this. Correct. Your easy dosage is going, let's say the treatment is going to be just a pill. So I'm going to call it as a unit. So let's say there are going to be 3 patients. For all the 3 patients, it is going to, let's say all the 4 patients, it is going to be the same. So they never know in the double dummy trial what exactly going to happen is the subject is going to expose to either one of the 2 treatments or to the placebo. What do you mean by that? He might have treatment A pill, he might have treatment B pill, or he might have a placebo like this. Treatment A, let's say if it is going to be a pill, either treatment A pill or treatment B pill, or it is going to be placebo. The patient is going to have any one of this, not all the 3 or any of the 2. It is going to, he or she is going to have any one of this particular one. Any one of this particular one. So we don't know out of these 4 who got the pill, who got treatment A, who got treatment B, and who got placebo. We don't know that. To know those particular details, I need to go with exposure domain again. You understand now what I'm trying to say? Here you don't know whether it is a treatment A, treatment B, or it is going to be placebo. But when it comes to this particular one, it is pretty much clear. It is, let's say the first guy got treatment A. which is a 150 mg tablet, dosage is equal to 150, units is equal to mg. The second guy got only placebo, no dosage at all. The third guy again got treatment A, 150 GB, sorry, 150 mg. The last guy, he got treatment B. Let's say it is going to be 300 mg. So what is the exact dosage? What is the exact treatment the subject has actually taken? That information will be part of your exposure domain, which can be derived from your exposure as selected. Is this understandable? Now you understand why do you need both of them? Can anyone please raise a question? If you have anything, or if you're not able to follow, please raise a question. Otherwise, is this understandable? Why do you need two different domains? Clear or not, or any questions, I'm happy to answer. Anyone? Vamsi
Sir,
Krishna,
both
please.
both the data sets we have to submit, or any one we have to submit?
Yes, wonderful. Who is this? Is it Vamsi Krishna or who it is?
Money
Or
Maran
is it
here.
Vamsi Krishna? You asked me to repeat. Can you tell me what you understand, what you haven't understand, so that I can tell from where I have to. Okay. Before going with that, Manimaran, yesterday I have answered this particular question, but I'll repeat it. See, the SDTM implementation guide recommends submitting both EX and EC if necessary, though including EC is not required. Ideally speaking, your EX has the complete details, correct? The exact details are present in your EX exposure, correct? But why your SDTM implementation also requires to go with EC means your exposure domains will missing two things. Number one, it only have the protocol defined data, right? Let's say you need to take one pill on daily basis. So a subject has taken this particular pill on 31st June, 1st June, but 2nd June he haven't taken, he missed it. This information will not be part of your exposure. It will only mention that the subject has to take this pill on daily basis. That is, what is the frequency, what is the dosage, what is going to be the units. Those information will be part of your exposure. Whether the subject has taken that particular pill or not, whether he missed it or not, those details will not be part of your exposure domain. Those will be part of your exposure as collected, because it has the information about the collected and administrated. Correct? So that is the reason it is recommended to have both the details. Am I clear? Right? SDTM implementation guide clearly mentioned that we would need both the data sets. It
Yeah,
is
it's clear.
required.
Thank you.
Yeah. So that's the only reason yesterday, though it is going to be only exposure data set, first we started with what is what, why we need to, and what we need to submit. Okay, but please ask me as many questions as possible. Not an issue. Vamshi, has it repeated? Okay, you want me to go with one more time? I'll go with that. Not an issue. Please don't say that you understand without understanding it. All right. The only reason why I'll ask you a specific question, let me know why what you haven't understand is just wanted to know up to where you follow. Nothing more than that. Okay, perfect. So as long as you understand, I'm good. Okay. So shall we proceed with exposure as collected today? It is going to be a very simple one because it is going to have almost all the data which we have in your exposure domain, right? I'll do one thing. I'll just save as this. I'll just call it as exposure as collected. Done. Maybe this information I can also keep it as it is. It will be useful. So from here, I'll change. This is going to be exposure as collected because it is going to be the same variable. So instead of copy pasting it, why can't I edit the same nodes? It's going to be okay. What it is going to capture? It is going to okay. If miss a dose, it goes to EC and as well as DV. Okay, DV is protocol deviation, correct? But it mostly talks about the treatments. It talks about the treatments, not the medicines, right? Deviation protocol will talk about, it won't talk about what happened, or it won't talk about the outcomes of the one. It won't talk about the outcomes. It won't talk about the medicine there. Okay. So Priyanka, answer to your question is going to be protocol deviation. In the protocol deviation, what got deviated will be mentioned. But it is very specific to the term, that is your DV term. What exactly your DV term is going to be? Maybe I can open the notes, I can show that to you, so it will be easy. This is what your protocol deviation is. So what are going to be the violations and what are going to be the deviations? Perfect. Now, what is going to be the protocol deviation, right? So here you can see it is going to talk about IVRS process deviation. Took aspirin drug, it is a prohibited drug, right? A prohibited drug has been taken. But what about your EC? EC will talk about what is the intervention to your study drug. Is it a study drug? No, right? So 100% it will not match with your deviations that are happened, but it will talk about if it is related to the study drug, in the study drug violations happen, it is going to be noted. Yes, it will get noted, but not everything, because this protocol deviation will also talk about anything other than the study treatment also will be recorded here, correct? So it will not have all the details, because your question is straightforward. It is going to be, will the, if I miss a dose, will it goes to your EC as well or not, right? It is not going to become a protocol deviation, because your clinician or investigator asked the patient, asked the subject to take this particular pill. The investigator said that, hey, you're supposed to take this particular pill for 1 week, so they have given the pills. If the patient missed to have that, patient neglected to have that particular pill, right? It will be collected, the information will be collected, but will it fall under the protocol deviation? As per the protocol, pill has been given, but who missed it? It missed by the subject, not by your clinician, not by your investigator. It is not the deviation that I want to report there, correct? So it is a bit tricky part, but slowly you can understand this, not at this particular point of time. But answer to your question is not exactly. It won't go if I miss a dose, right? It will only go to your EC, but not to your. Am I clear? But if it is related to truly, yes, yes, exclusive study drug deviation will go to EC. Correct. See, it is all about what is going to be the effect, how the interventions of your study drug on your subject. Yes, only the study drug. Okay. So there will be always, you need to talk about, how it will be mentioned there, how it is going to be displayed here. Remember one thing, maybe the most important thing, all your deviations are, even in your what is it, exposure domain. Let's say exposure as collected domain, the one that we are discussing. In this, there is going to be a variable called EC occur. So we have MH occur, we have AE occur and all, correct? So the occurrence. This particular variable will tell you whether the patient has taken the drug or not. If it is N, there is something wrong. The subject has not taken the pill. The subject has not taken the treatment. This is the variable which is going to mention it. If you go to your deviation protocol, you don't find anything occurrence here. You don't find it. So it won't get recorded there. Am I clear? Priyanka, is that making sense? Others also. Anyone, any questions? Perfect. Perfect. So slowly, when you get the understanding about how the domain is going to be and what are the variables are in that particular domain and which variable is going to represent what, if you get that particular understanding, you can easily connect all the dots, right? Remember only one thing, only one thing. Special purpose domains from the beginning, it mostly talk about your subject individual information, the comments that are mentioned, what are the various elements, what are the various visits. Those are special purpose domains. Something happened that can be prior to the trial, which is nothing but your medical history, a minor unforeseen event, which is nothing but a clinical event, a major or serious unforeseen event, which is nothing but your adverse event. There is some deviation from the protocol defined terms, your deviation, and you have the disposition. Correct? These are all related to events. Something happened. What is happened, we recorded here. That's the reason all these have a topic variable called term, XX term. What do you mean by XX term? What happened there? What event happened there? Give me the event details. Interventions. Because of the event, either it can be adverse or clinical, or it can be medical, or it is going to be protocol deviation, that is unwanted drug that the patient has taken. It can be anything. Because of that, you're taking a drug or you're taking some treatment. What is the treatment is? Is it a study treatment or is it going to be a other than the study treatment? If it is study treatment, EX easy. If it is other than the study treatment, CM. That's the reason your exposure variable is going to be treatment, not the event. It's a treatment. Substance usage, which is nothing but what is going to be the behavioral aspects of your subject. So your topic variable is the one that you need to catch. That is going to give you the guidance. Make sense? Now is this understandable? Right? It will take little time, guys. It will take little time, but you'll get adjusted. Questions now. So now you understand why we talk about the focus with topic variable a lot, because it is going to give you a focus on what this domain actually is all about. That information you will get based on your topic variable. So that's the reason in every domain when we are discussing, we clearly write your domain details there, your topic details there. What is the nature? Why we are discussing these at the start of your class means because this is going to define your domain. These are the ones which are going to define your domain. So you need to understand them and you need to remember them all the time. Most of your topic and identifier variables are also going to be required variables. So if you remember them, if you're able to understand them, you're going to have a good grip on your domains as well. Questions? Is that making sense now? Can I proceed? All right, perfect. So now the same stuff repeat, but first we need to understand what it captures. So it captures the details of the subject exposure to protocol specified study treatment. In addition to that, administration, that is what has given actually, and administration as collected. Sorry for the disturbance, guys. Just give me a moment, please. Okay, sorry guys, I'm back. All right. So what we are talking about? We are talking about what is going to be the data that we are going to keep it under EC. So if you go to the exposure, it is only up to this. I can say that captures details of the subject's exposure to protocol specified study treatment, but it won't capture about how it administrated and how it is collected. How it is administrated, we don't define there. But when it comes to the exposure as collected, we also collect this information. That is, have you given that particular drug or not? Have you scheduled the drug or not? Have you performed the treatment or not? Those details will be additionally collected. Yeah. Number two, what is the nature of this particular one? One record per protocol specified treatment, constant during interval per subject. In addition, per mood. What is this new thing? What is this mood is all about? I'll talk about this. Mood is the one which is going to represent, ideally speaking, the mood is nothing but it's a mode or condition of the record. What is that? It is a condition of the record. Meaning, so you want to, I have to give a drug, whether the drug is scheduled to the patient or not, whether the drug is already performed or not. The treatment is scheduled or not, performed or not. The drug is already given to the subject or not, whether the subject has already taken it or not. So mode is all about the mode or condition of the record specifying whether the intervention is intended to happen or it is already happened. I'll talk about it in the variable list. But understand this, one record per protocol specified study treatment, constant dosing interval per subject per mode. You know what is called constant dosing interval, right? What is constant dosing interval? The same drug, the same dosage, the same units has been given to the patient over a specified period of the time. If yes, you can call that as a constant dosing interval. Clear up to this? Now, what is going to be a topic variable? EC treatment. Then what are going to be your identifier variables? My identifier variables are going to be study ID. Then you have the domain, you have the unique subject ID, you have exposure as collected sequence number, then you have a group ID, then you have the reference ID, then you have the sponsor defined identifier, then you have which is going to be the link ID, that is nothing but across any other domain, is it related or is it linked or not? If yes, what is that particular linking group? The same identifier variables will be also part of your exposure as domain. That is the reason I just want to use the same notes here as well to explain the variables. Then variables definitions, study ID, it is nothing but a study identifier which is mentioned in your protocol, which is also mentioned in your unrated CRF. Sponsor is the one who is going to view this particular one. So your domain, which is going to be a 2-character abbreviated for your abbreviations for your domain. In our case, it is going to be EC. Unique subject identifier, again the same stuff, a universal one. It is going to be a combination of 3 variables: study ID, site ID, and the subject ID. Now I'm going to have the sequence number. The sequence number is at a patient level. I can say that in the whole domain, it should be a unique value under each subject. So how we are going to create it? We are the one we are going to define this particular one. Correct? I can simply say that it is going to be EC sequence. So you are the one who is going to generate this particular number, and you can generate this by using your first dot and last dot, or you can also use any other treatment, right? So what coding level we want to do it, we don't need to worry about it, but all we need to understand is going to be this is the one which is going to be unique at a subject level within the domain. Then we have a group ID. What is the group? Like if I want to tie a related records, how to tie them? For that, we are going to use your EC group ID, a sponsor defined identifier, which is going to be, it's printed in your CRF as an identifier, or it is also defined in your sponsors operational database. Same thing. EC reference ID, the same reference ID, it can be your internal or external identifier. There won't be any difference there. Just a second. All right. Now I have this one, that is across the domains. If you have any related records linked to it, we can use the EC link ID. The same thing is going to be EC link. Up to this, it is going to be the same. No changes at all, because only few variables will change. Otherwise, the meaning, everything remains going to be the same. So if you understand your exposure domain, it is easy to understand exposure as collected and vice versa. So exposure as collected category, that is treatment category, it is going to be the same. Subcategory of the treatment is going to be the same. What is the dosage? What is going to be the dosage description? What is going to be a dosage units? And what is going to be the dosage from? There is dosage from tablets, lotions, or what? And finally, your dosage frequency. Because all these are together and talks about your dosage. So I just went all these together. Any questions? I know that I'm going a little faster because it is a repetitive session of your yesterday's one. Correct? So no changes at all, right? The same ones as it is will be repeated. No changes at all. That's the reason I'm not changing anything as it is. I'm writing from the yesterday's one. Again, exposure as collected, that is your intended dose regimen, right? When to take off, or how many days you need to take off, or what is going to be the washout period. So all these again going to be the same route, whether it is a oral one or intravenous, how exactly the drug has to take. Up to this, again the same. So you have the lot number. Group of medicines come as a lot. So what is going to be the lot number, or what is going to be a numerical value of that particular one? Still, you can use your lot there, right? Then I have EC location here. Whether I have EC location here or not. Okay. From here, I need to write a few more. So after EC lot, we have something called EC location. What is that? Location of the dose administration. This is one additional stuff. I can call it as location of dose administration. Right? It simply specify the location. For an example, it can be of your let's go with the simple ones. You don't need to be really difficult on this particular one. Is it something you are giving to your arm, or it is lip, or some treatment that you want to give it, or some treatment you want to do it on your abdomen, stomach? How exactly it is? Where is the location? Right? The location details will be fall under your location of dose administration, which is nothing but ECNOC. Right? The laterality remains going to be the same. Is it left, right, bottom, top, or it is going to be the center, or it is going to be proximal? All these are going to be the same. So I can go with the laterality as well as your directionality going to be the same. The same terminology I can use here as well. Okay, done. One additional thing will come here, right, which is called a portion or totality, which is almost equivalent to the total amount of dosage that we have taken. But some, I can say that some implementation gets even the same version. Few of them have it, few of them doesn't have it. Anyways, it is going to be a permissible variable. So I'm not mentioning that here. There is a variable called ECPORTOT, which stands for portion or totality. But I'm not talking about that one here. I'm just telling you explicitly. Then I have the fasting status, whether it is, what is the fasting status, yes or no. That also we are going to write it here, right? Then there are two new variables will come here. Those two new variables again I'll discuss because those are important. Those are nothing but your your exposure as collected. What is going to be your pharmaceutical strength of that particular one? That is PSTRT. It only talks about pharma What is going to be your pharmaceutical strength in your particular treatment or in your particular medicine? What do you mean by that? What do you mean by the strength of this particular one? I can simply talk about this as amount of active ingredient. So you have the ingredient list, right? There are a lot of ingredients in your medicine, right? There's a lot of composition. So what is the active ingredient and what is the composition of that one, right? So that we are going to give this particular one, give this information, but you need to give this information per dosage. First one is per dosage unit, per unit of volume, per unit of weight, right? Or whatever is mentioned as per your pharmaceutical drug. It can be one capsule, or it is going to be something like, I have to take 5 ml of this particular one. Suppose if it is going to be an injection, you need to go with 2 ml on each of the dosage. So per unit weight or per unit volume or per dosage unit, we mention this. It is all about what is the active ingredient of your particular medicine amount. It only talks about your active ingredient details, right? So now, when I say it is a active ingredient unit, how you are measuring it? Is it mg per tablet, or it is mg per ml, or it is mg per kg? How you are mentioning it? There should be a unit for that, right? And that unit is nothing but your EC PSTRG U. U stands for unit. That is your total pharmaceutical strength unit. What is the units that we want to define? The examples are going to be, is it going to be something called your mg per ml, or is it mg per kg, or it is going to be mg per tablet, 500 mg tablet, or how we are going to mention this particular one? That information will go under your pharmaceutical strength unit in your domain. Clear? Now again, these variables will follow as it is. EC adjust. Why you are adjusting your drug? What is the reason? That reason you have to mention. Approach, same thing. Then I'm going to have EC here. The EC is going to be, that is EC SDTM. Start, date and time of your treatment in character format. End date and time of your treatment in the character format. Study day of start treatment. Study day of end treatment. Oh, here also the same. Sorry. All ECs are done. So again, I go to the ECs here. Now I'll go with ECENDY, study day of entry. Then you are going to get EC duration of your treatment. You generally don't derive it. It is going to capture as is from your which one? Your CRF. Correct? Then again, I'll start with your time point references. That is nothing but ECTPT, which is nothing but planned time point. Then you have ECTPT numeric, which is going to be the numeric version of your previous one, right? Then you are going to have ECTPT reference, which is nothing but time point reference from your previous dose. You don't get this particular one, elapsed time and all, you don't get it here. And finally, we are going to have ECRFDC, that is date and time reference of your time point. So what I'm trying to mention here, almost whatever you have in your ES domain as is falls under your EC domain with some additional details. Correct? So what are those additional details? Your EC occurrence is the one which will define whether the patient has taken the drug or not. It also talk about what is going to be the pharmaceutical strength of your particular dosage and respective units, right? These are the additional information that we are going to capture here. Otherwise, since you're going to derive your EX domain from the EC domain, so your EC domain has almost the same information, same variable data as your EX domain. Clear? Right? So one part is still pending from my end. I need to explain this with the examples. I want to take all the examples tomorrow, not today. Tomorrow I'll take all the examples. Maybe the first half an hour I'll go with the examples, and finally we go with our last domain in your interventions, which is nothing but the substance use. That I'll take tomorrow. Substance use is a simple one. It won't take time. It won't take time. So once we have it, so maybe you can have a break on Monday, sorry, Sunday and Saturday. Then again we can come back and we can discuss. By Monday we will go with the DM domain and the coding for the DM. Clear, guys? Is this understandable? Can I have a quick confirmation? So there is one more domain, you can call it as a procedures domain, but that I am not discussing here because it is a new one, and I can say that rarest. So though even the procedures is part of the interventions, I'm not going with that. If anyone is very specific about it, Murli, as part of my work, I have been facing this particular domain. Can you throw some light on this? In that particular case, yes, definitely we can discuss. Right? Procedures, it's all about what are the various procedures that I have taken place. Right. So substance usage is a simple domain. It also going to have almost same variables, same stuff as your CM, as your exposure, or as per your exposure as collected. Almost same, right? Only thing is what will flow there we need to understand, right? What will flow there we need to understand. That's the only difference. Otherwise, everything is going to be the same, right? So it is all about whether the patient is going with the cigarettes or patient is having is a teetotaler or not. These kind of details. Yeah, someone want to ask some question?
Yeah,
Please ask.
Murli.
Yeah, Mahipal.
Yeah, Murli. Actually, I have some confusion. SC and SV domain for coding purpose.
Okay.
So,
What is the
which
confusion?
one? Which data set can I use for this domains? So I'm a little bit of confusion in that.
Which data sets in the sense? Are you
Yeah,
talking about the raw data set?
yes, exactly.
Okay. I haven't I provided or I haven't provided that?
Yeah, we received actually. So in
Uh-huh.
that only I'm checking.
Okay. Maybe just give me a second.
Yeah, sure.
This is the one I might have shared with you. Correct.
Yes,
So in the you have raw data. So
yes,
you
this one.
want to know what, yeah, you want to know what you need to use it for SC and what you need to use for SV. Correct?
SV. Yes,
Subject
yes,
business and
yes.
subject business. I'll tell you. I'll check that and I'll tell you. I just go through the panel because I want to see the specification Excel. Then only I can understand. Because multiple projects are here. So let me check and I can come back on that today. Okay. I think you dropped a message
Okay.
to me, correct? You
Yes,
dropped a
yes,
message.
Murli. Yeah.
Okay, I'll reply to that. I'll reply.
Okay, Murli. Thank you.
Any other questions from anyone? Okay, for DV also, which, okay, I'll do one thing. I'll write one simple Excel. I'll give you what is the raw data for each of the domain. So that will give you a clarity and that will give you a guidance. Will that be okay? That is easy, right? All the domains, what is going to be a raw data set that you're supposed to use? I'll go with that.